Hi, good afternoon, everyone, and welcome to today's webinar session hosted by PMMC. So today we are going to be talking about how to leverage analytics in a contract management system to better maximize reimbursement. So today we have an hour scheduled, and we should have some time for questions at the end. So if you do think of any questions during the session, go ahead and enter those into the questions tab in your GoToWebinar panel, and we will have a chance to answer those at the end. So let's go ahead and get started with some introductions. So my name is Brad Josephson. I'm the Director of Marketing here at PMMC. And PMMC is a leading provider of revenue cycle software and services with about 400 hospital clients nationwide. Joining me today is Greg Kay, Senior Vice President at PMMC. Greg has 30 years of experience in healthcare and has been with PMMC for 20 years. Welcome, Greg, and thank you for joining us today.
Thanks, Brad.
Also joining us today is Jenna Seymour, the Revenue Enhancement Manager here at PMMC. Jenna has 10 years of experience in the healthcare revenue cycle. Welcome, Jenna, and thanks for joining us today.
Thanks, Brad, and hello, everyone.
So, because we are talking about reimbursement today, we wanted to start today's session with some background on what's been going on with hospital revenue over the last several months due to the COVID-19 outbreak. According to the American Hospital Association, the financial impact to hospitals has been about $200 billion over the last 4 months, or about $50 a month. $50 billion a month. Now, on the right-hand side, you can see that chart there, and that talks about the service lines that have been impacted the most. So with revenue so tight right now, today's session is extremely relevant as reimbursement is more important now than ever. So to talk a little bit more about that, I'm going to go ahead and turn it over to Greg and Jenna.
Great. Thanks again, Brad. And we do appreciate everyone joining us today. And as HA reported, most hospitals are financially strapped these days due to services being down. So it is extremely important that we're collecting everything that you're contractually due. So we know it's just a level set. Payers generate reimbursement variances. And often these variances, whether they're denials, contractual underpayments, short pays, no pays, etc., they often start due to breakdowns in various revenue cycle areas. These breakdowns can be linked back to really a couple of key categories, if you will: people, processes, technology, and/or data. As an example, medical necessity denials and/or contractual underpayments could be due to any one or a combination of these 4 areas. Denials related to coding could be a staffing issue. In other words, are the right people in the right place? Or if additional training is needed, there may be a process breakdown. Another process breakdown example could be how effectively are you keeping up with payer contractual updates, such as the traditional quarterly changes with Medicare Advantage plans, or more recently, really tracking authorization waivers or telemedicine reimbursement adjustments over the past few months. As you're assessing whether variances are occurring, at the end of the day, prioritization processes should really start with an understanding of the impact of those variances on net reimbursement.
That's a really great point, Greg. Reimbursement variances often occur at a rate of 7 to 12% of all claims, and that's after rebilling and starting the appeal process. This translates bottom line impact of 1 to 2% with contractual variances and a 2 to 3% impact with denials. The good news is a high percentage of denials are appealable and a significant amount are preventable. It's also really important to note that the average cost to rework a claim is $25.
Yeah, so, you know, as it relates to prevention, many organizations still do view denials as a back office task, while studies have consistently been published and have shown that registration and eligibility issues are typically the high percentage of denials, often, you know, more than 30%. In this area, you know, proactive improvement can truly assist in preventing the issue. So while organizations also view denials as needing to be handled as insurance follow-up steps, when in fact there are clinical factors that may also need to be addressed. Medical necessity, requested medical documentation, and medical coding is often nearly 20% of overall denials. In this particular area, the recovery of underpayments can be viewed also as a prevention step. In other words, not letting the underpayment remain unpaid. So process maturity, just as a level set, as defined by Six Sigma, is outlined over 5 steps or levels. Hospitals should have a reimbursement variance process in place for really the first 3 components. Some organizations have these steps in place for just denial management, but really we should be looking at and thinking through and ensuring that we've got these steps in place for all variances. So using, for today's discussion, Six Sigma terminology, that means you have a documented process that is fully deployed for all reimbursement variances. So at the first kind of baseline necessity, there's accountability. And this is the baseline data gathering step and workflow process. This starts with really categorizing denial codes and contractual variances. For denials, this could include grouping your CAS codes to denial reasons in categories such as registration, pre-authorization, pre-cert, medical necessity, missing data, medical documentation request, coordination of benefits, etc. For contractual variances, this could include things like add-on reimbursement items, stop-loss provisions, incorrect multi-product discounting, paid at a prior rate schedule, etc. As it relates to workflow, it moves on to routing and user assignment, utilizing work list and access to really the detailed denial or contractual data behind the variance. This component may be in place with your patient accounting system. Some organizations may be using spreadsheets. You may be using separate denial or contract management tools and or some type of 835 data aggregation tool. Again, this is the basic necessity step of accountability and really where the starting point should be in terms of process definement and process improvement. So as we go up the process, reporting is really the next basic access to data. And at this level, there are typically standard reports that provide a baseline operational insight for accountability. Report examples would include things like reimbursement variance by payer, variance by category, variance by code. And we'll do a deeper dive with some example reports here in a few moments. Jenna's going to walk through some of those examples with us. As we kind of move on up the curve, there's a little bit more of a ramp up here as we start to look at and incorporate prevention. And that's the overall goal of eliminating or resolving the issue. And this includes things like implementing systems or process changes, such as using a denial category or a denial code reporting to drive changes in the EMR or your HIS system. Or it could be a medical necessity report that may identify the need for front-end diagnosis edits or claim edit software that may be used to correct variable registration numbers. So as previously noted, with registration and eligibility denials often being the highest percentage of denials, eligibility verification should occur when we start thinking about prevention multiple times at scheduling, 3 days prior to a service, before claim submission, to again proactively reduce denials and again reduce specific reimbursement variances. So the combination of reporting and analytics really are the catalyst or drivers to process improvement.
You're right, Greg. And one thing to really keep in mind is that prevention is described as the middle step or middle level on this maturity matrix. Correcting and reversing the denial or contractual is what creates more immediate cash flow, which we all want. Reimbursement variance recovery is a component of this level. If payer payment rules, coding requirements, and patients stayed with the same payer with the same benefit plan forever, prevention would likely mean completely eliminating the problem, which would be nice. Unfortunately, these items are not static, they are dynamic, and we may not know what to prevent until something of value is denied, and this makes the appeal a part of that prevention step because ultimately we still want to be paid for those provided services.
Yeah, great point, Jenna. And another way to think about analytics is really the concept of root cause analysis. In other words, reporting provides us the quantitative insight, whereas analytics should provide both quantitative as well as qualitative assessments, such as the most common denials, how much of an impact are denials or contractuals really having on net patient revenue, and the reasons for denials. The two, qualitative and quantitative, really work together as drivers, but the incorporation of benchmarks and constant feedback loops is really what separates analytics up and above and ahead of reporting. So as Jenna noted earlier, with reimbursement variances often occurring at a rate of 7 to 12% of all claims, and the rebilling and appeal process, after that occurs, it can translate to a 2 to 4% bottom line impact. And this type of error rate is truly more unsustainable than ever before based upon the stats and what we're living through here in the current financial environment. So to accomplish real improvements, measurements are critical, especially against benchmarks, because as we know, without measurements, we don't know if improvements are being made, and we don't learn or know what is really meaningful. Reimbursement management analytics should be built on a foundation or a concept, if you will, of performance measurements. So in the simplest form, this is an aggregation of 835 transaction sets, but more broadly, denial and contractual data analysis should include additional information, such as the expected reimbursement or the expected allowable, to really understand the impact of those variances on net patient revenue.
Greg, I actually have a good example. Many hospitals report denials using total charges. This often prevents you from effectively prioritizing your denials and driving cash in the door, which we all want. For example, just because a Medicare account has a $10,000 denied charge doesn't necessarily mean it's more valuable than a Blue Cross Blue Shield account with a $5,000 denied charge.
Yeah, absolutely, Jenna. We have to constantly remind ourselves and look for those examples because in that process, we can see that performance measurement is that continuous process that really involves checking the performance against a determined standard or target. So when an external standard is not available or may not seem to be applicable to you, an analysis of your historical data can also be used to establish a target. The critical point here is to establish your targets. It's also important to remember that with the volume of data associated with denials, you also have to incorporate many times the utilization of the 80-20 rule. You know, knowing the top 20 to 25 denial codes that represent 80+% of your denials may be a great place to start. You know, according to you know, management by exception guru Frederick Taylor, managers should really concentrate on only the exceptional deviations instead of trying to correct each and every deviation. In other words, if you're trying to control everything, you may end up controlling nothing. So let's look at 4 example metrics that PMMC uses to drive accurate expected reimbursement calculation accuracy. Calculation accuracy percentage here is how accurate are the calculation models in comparison to the payer contractual arrangement or agreement. Your calculation should be at least a 99.98% accuracy level. Errors really relates to how accurate is the data management and matching process. Contracts being current, as referenced earlier, is how consistent are you with really keeping up with contracts and ensuring they're up to date and current. In other words, you're calculating current billing data off of the most current reimbursement rates and terms. Overall accuracy is really what your overall contract accuracy rate is. With Medicare as a benchmark, you would expect to see a 99+% accuracy rate and often lower rates with other payers because, as we noted before, there are variances that do occur, and the important thing is to have the right metrics to help you improve your overall workflow efficiency. These are just some of the metrics that we use to ensure that our calculation accuracy really flows through and helps the overall efficiency of the process. You know, in other words, your staff needs to ensure they're spending time reviewing variance accounts that truly are collectible. In other words, through the research, as they see variances, we need to ensure that those variances truly are collectible variances, not false variances that could be tied to an inaccurate calculation, the data not being correct, the contract not being correct. We want to eliminate all of those false variances so that you gain efficiency by reducing the wasted time that you would spend on things that are variances but are not collectible variances. You manage what's measured, and these are our performance metrics that really lead to our clients and our staff having better collection results. There are also other positive unintended consequences, such as improved insight with payer scorecards because you know the underlying data is correct, better analytical reporting that we touched on a moment ago, as well as better prospective contract modeling because, again, the underlying data is correct and accurate. So with current reimbursement variance rates of 7 to 12% really occurring with all claims, and after the rebilling and appeal process, it translating to 2 to 4% of a bottom line impact, managing these variances, whether they're denials or contractuals, continue to be a challenge. And one way to help move the process forward to the next level of analytics is really incorporating data visualization. Now, data visualization tools do provide an ideal way to incorporate performance measurements and enable users to really view and understand vast amounts of information. At PMMC, we use a tool called Power BI. This is an application provided through Microsoft, and it attaches directly to our SQL databases. There are other tools such as Tableau or other applications out in the market. But really, data exploration, such as the drill down ability, provides a better or more deeper analysis of various components that often, again, drive metrics. From a Six Sigma standpoint, as referenced earlier, this would also be referred to as that root cause analysis. So using real-time data visualization, a manager can view the latest figures and see the current overall account activity, the denial code volume, and really respond more quickly to a potential growing issue. As an example, a static denial report that a manager may be using today could inform them of the overall denial rate with a payer, and it may inform them that it is up or down for a particular month. However, it wouldn't really inform them on why that could be up or down. That's where data visualization and the drill down ability really does allow users to quickly assess and determine the root cause, allowing staff to be adjusted to address those volume increases or changes in a mid-month cycle. This type of analysis really requires, again, some baseline principles, starting with data capture processes with an accurate, detailed underlying data. So you've got to make sure that the underlying data is accurate, so that summary data will limit your ability to drill down to actual insightful data. So it's important that you marry up those two pieces. In the coming slides, we'll be reviewing various reporting templates with categorization and those drill down options, so you can start to see and really discover how powerful analytics can be and how you can actually apply some of these steps and methodologies. Now, closing out with the visualization, there was a recent study done by the Aberdeen Group, and it found managers and organizations that use visual data discovery tools are more likely to find relevant information compared to those that rely on traditional management dashboards and traditional reports. This study also noted that managers at organizations that use data visualization tools are 3 times more likely to comment and share a report or a chart. And I think that's an important piece for us to really get our head around as we're having to work more in a remote setting these days. It's a little more challenging to walk down the hall and have a conversation. We've got to think through how can we utilize tools like data visualization to share information and gather feedback from our team members. And data visualization really does help do that with denial and reimbursement variance management, in that it helps facilitate a collaborative organizational effort when dealing with net revenue improvements. Brad?
Thanks, Greg. And with net revenue truly being the bottom line, contract governance really does serve as the foundation for reimbursement variance analysis. So Jenna, can you walk us through what this looks like from an inpatient contract rate standpoint?
Sure. So accurate reimbursement variance analysis, like Greg had said, should always start with accurate calculations. But what should that look like in terms of data visualization? So you have here on the screen a really good example of a basic Anthem PPO contract. And as you can see, a user can quickly view the reimbursement by contractual methodology, by service line, add-on reimbursement item, and actual volume by each for inpatient services. This is a really great tool. This example right here highlights similar insight for outpatient services. Again, with the right data analytics platform for managing reimbursement variances, the process for knowing and quickly having your reimbursement rates in terms leads to improved contract governance.
Yeah, and Jenna, this is also a great example of what the industry is grappling with as it relates to the upcoming price transparency mandate requirement that's scheduled for 1/1. In the final rule, CMS outlines that the mandate will require hospitals to post their baseline rate schedules for all payers and plans. And their assumption, being CMS's assumption, is that all hospitals have tools today that can easily and quickly produce this type of information. Unfortunately, many hospitals still bill charges and allow the payer to compute the payer allowable, which leads to variances because this data is just not readily available and is tied back to actual reimbursement. If the mandate does hold up, the right data analytic platform will help lead to both a more efficient contract governance process and an easier process for staying compliant with these upcoming price transparency steps and requirements.
Yeah, and Greg, I'd like to take a pause here and poll the audience about that point. So I'm going to run a poll here, and the question we're going to ask is, on a scale of 1 to 3 of preparedness, 3 being very prepared, 2 being somewhat prepared, and 1 being not prepared, how prepared is your organization for the anticipated January 1st price transparency mandate? So we'll give the audience here probably about 30 seconds or so to cast their votes, and then we'll share the results here in real time to get an idea from the audience. All right, well, it looks like the majority of the audience has voted, and we'll go ahead and share these results here. So overwhelmingly, 72% of the audience says that they are somewhat prepared. A smaller percentage, 16%, say they're very prepared, and then 12% say they are not prepared. So thank you for contributing to that poll. We'll have a couple more throughout the presentation as well. So let's switch gears here a little bit and talk in more detail about reimbursement variance analysis. So we know that every hospital faces challenges with underpayments and denials. So I'd like to walk through some common examples of revenue variances. So how would we recommend start looking into these trends?
Okay, Brad. So like Greg previously stated, the combination of reporting and analytics are the real catalyst of process improvement. So this high-level dashboard allows you to gain executive insight into your hospital's improvements. To accomplish these improvements, benchmarks are critical. In this example, you can see there is a 1-day variance in days in AR, aka room for improvement. At the same time, you can see there is a negative 0.1% variance in denial rates, a small improvement. And then lastly, 6.8% improvement for payment accuracy, a pretty decent improvement. But without these measurements, we won't know what is meaningful, and we all know right now how meaningful AR opportunity is. So as we dig a little bit deeper into the opportunities component, we have an example of a payer scorecard. So this scorecard allows you to see which payers have the greatest opportunity in comparison to which payers have the greatest charge volume. As you can see in the example, Medicare has the highest charge volume, but is not the top payer with the greatest opportunity. Effectively prioritizing your denial and underpayment opportunities is what's ultimately going to drive cash in the door. So circling back to what I had mentioned earlier, a high amount of denials are appealable and a significant amount are preventable. By utilizing this data and visual analytics tool, you can see over time if payers are denying more reimbursement, which is huge to look at. Taking this one step further, you have the ability to review payer detail in top denial codes. We want to know, is this a clinical factor that needs to be addressed? Is this a front-end authorization issue? This information and breakdown right here allows you to explore the root cause, like Greg had mentioned, to resolve the issue and prevent it going forward. So now that we've reviewed where the payer opportunity is, let's review where we cover the greatest underpayment amounts. So this example right here will give you a great data visualization of where your collections comes from. So it allows you to distinguish between denial recovery versus non-denial recovery. By facility, do you have one facility that is outperforming the rest, or one that maybe needs additional resources or attention? Or how about by payer? Which payer accounts for the majority of your revenue? Do you know which payer that is, and is it the payer that you expected it to be? Or how about by auditor? Who is your top auditor, and who may need additional training? What tips can your top auditor offer to the bottom ones? As a manager, to be able to view this data allows me to be able to quickly respond to a potential growing issue and stop it in its tracks. Now, taking that one step further, how can we identify issues and use analytics to improve our recovery process? This recovery analytics report right here presents recovery success rates in various ways. You can see which payer you have the greatest recovery success with, which underpayment tranches you're most successful with, and you can even break that down to which procedure codes and even which denial code you're most successful with. All that information can then be used as insight to help optimize your payer recovery process. By using this Dynamics analytical tool, you can see that with Blue Cross, my overall success rate is 48%. I can then click on Blue Cross and filter down to my Blue Cross performance and see what products or procedures I'm doing well with or not doing well with and make adjustments as needed. Furthermore, it's important to see how performance is over time. So you can see in this example right here how tracking your workflow and success rates helps you identify how things are trending over time. Very helpful tool.
Great, thank you, Jenna. And at this point, I think this is another good time for a poll question as you were going through those points of how you really evaluate your underpayment recovery success. So the next question is, on a scale of 1 to 3, how effective are your current analytics at your organization for tracking underpayment recovery success? And the same options here, 3 being very effective, 2 being somewhat effective, or 1 being not effective at all. And again, that question, how effective are your current analytics for tracking underpayment recovery success? Very effective, somewhat effective, or not effective? And we'll give everybody a few more seconds here to get their votes in. Okay, I'm going to go ahead and close the polls out here, and I'll share the results. So this one was a little bit more split. So the majority said, 54% said somewhat effective, but we did have a quarter of the audience say not effective. And then a similar amount, 21%, did say very effective. So a little bit across the board there. So we're going to keep moving on here. So as we move on to our final portion of the presentation, I'm going to turn it back to Jenna, and we're going to talk a little bit more about how do we best manage our collection teams and how do we use analytics in order to do that. So one of the things that we can use very effectively is the concept of scorecards. So Jenna, can you walk us through a few examples of those scorecards, what they look like, and then how that can help us best manage our collectors' workloads?
Absolutely. So how do we manage collectors' workload? We start with an optimized, documented workflow process, like Greg had mentioned earlier, and we utilize reporting and analytics. So we all know how tedious healthcare can be and how important it is, especially right now, to bring in the revenue. Having an optimized and efficient workflow process is key for improvement in any process. So this example, this scorecard right here, the collection scorecard, so you can see this is a collector work queue. It's simple, yet very effective. This collector knows the number of accounts in their work queue. You can see 89, their work queue balance, their average day's age, and average balance. there is a visual representation there in the bottom left corner that you can see of how much money is in each aging bucket, and then there to the right, they have a list of accounts they need to follow up on for the day. So what we want to utilize this for is to make it as simple as possible. We want to eliminate the guessing of what do I work today, where do I go next, what's priority and what's not. So we utilize analytics and visual representation, so we take the guessing and what needs and should be worked completely out of it. And along with our collector work queue, we have a scorecard that helps measure and compare performance by collector. So along with their work queue, we want to know if they're doing a good job utilizing that work queue. So in this example that you can see, collector performance is broken down by team member and with many important metrics, some of those metrics being collections, collection rate, collection month to date, average age from submission to collection, and a few other important fields. I can easily use this to identify my top performers or those that may need additional assistance or training. This data visualization tool provides an ideal way to incorporate performance measurements and enables users to view and understand their performance, which is very key, especially when you're meeting and having those important discussions with your team members. This next scorecard, the team trends. Training collection processes across the team is another way that we utilize these fields. So this example allows you to get a visual of your team's performance over a period of time. You can see this one, for example, October 2019 up to April of 2020. So similar to the last slide, you can consistently see who drives more collections in a graph format, which makes it very nice when you're having those one-on-one conversations. And you can see their collections trend over time. This is a very nice visual. I use this in a lot of my meetings, and it's very helpful in that it shows the team where all their hard work pays off. And if there are areas of improvement, it's a quick diagram to say, hey guys, we didn't hit our goal here, let's push for it here. So this is a very great tool to utilize for settling quarterly goals and seeing where your team ends up.
Great, thank you, Jenna. And I'm going to run one final poll question here related to the collection team tracking that you just went through. So on a scale of 1 to 3, how effective are your current analytics at your organization for tracking your collector's success? And the options here again are very effective, somewhat effective, or not effective. So again, that question is, on a scale of 1 to 3, how effective are your current analytics for tracking your collector's success? Very effective, somewhat effective, or not effective? We'll keep the poll open here for another 15 or 20 seconds or so while everybody gets their votes in. And at this time, this is a good time for me to point out, if you do have any questions that you thought of during the presentation, go ahead and enter those in the questions tab. As we're coming up here shortly into the Q&A section, we'll be happy to answer any questions you might have. All right, well, it looks like we've got most of the responses in. And this one's a little bit of a mixed bag here. So let's share these results with everyone. So pretty split. So 43% said somewhat effective. About a third of you, 35%, said not effective. And 22% said very effective. So Jenna, I'm going to turn it back to you for some closing thoughts.
Okay. Yeah, it's very interesting to see those polls. Those are really good. So just to wrap things up, it's no surprise reimbursement variance drivers are reporting and analytics. These two key components are huge. I can't stress enough how important it is to help measure improvements, improve workflow processes, and ultimately just increase your bottom line.
Yeah, right through our agenda. These are all terrific points and really the key components of what we were wanting to point out today. As we start thinking about process improvement and where things are headed and where things need to go, the key going forward is really to incorporate AI which means we have to have tried and true processes to in turn automate those tried and true processes. And at PMMC, we're doing just that. Our development team has been working on machine learning and AI algorithms to lower false variances and to more quickly identify real collectible variances. An example would be the all too common registration issue where payer plan affiliations occur when an account is linked to a payer contract with two different plans, an HMO and a PPO plan. And if the account is registered to the wrong plan, algorithms should calculate the account against the other plans underneath that payer to really determine if the variance is a registration issue or a true underpayment. In other words, calculating that account under both the HMO and PPO rate schedule to truly identify what may be going on with that particular account. This type of pattern analysis and scoring activity really is going to lead to better practices for, in turn, machine learning to operate or to automate. And as we go forward, I think we're seeing really, regardless of the field, AI is where improved processes really are going to be driving significant changes. And at PMMC, we're really at the forefront of doing that with maximizing reimbursement variance analysis and really helping our clients improve their collection processes. Brad?
Great. Thank you, Greg, and thank you, Jenna, for all of your insight this afternoon. And we do have a few minutes to take some questions, if that's okay with you guys. I did have a couple come in from the audience here. The first question is, how exactly do you measure your recovery success? Which values are you considering for this calculation?
So we typically bring in the client's daily cash transaction log so that we can track back what we've identified as a variance. So we flag accounts, and from that flag date, we track additional payments that come in to be able to compare our additional expected reimbursement to what's collected at that particular point. From a reimbursement variance analysis standpoint, we look at different data points being the expected allowable to our calculated allowable, the expected allowable or reimbursement compared to total payments less the patient portion piece as well. And then we also look at the expected contractual to the actual posted contractual is another way of looking at variances. Jenna, anything you'd want to add to kind of that comparison tracking question?
Nope, that's actually perfect. The biggest thing, like you had said, is with the submissions, and we look at everything, and with the different fields that we utilize with these analytical tools and the visuals, we can see from the time that we've submitted an account to a payer, and then follow up on the days that it takes. We can follow up with the collections that comes in, and then we can track and trend that to help pull that information all together to see over time, what we're going to be successful on and what we're not going to be successful on.
All right, thank you. Next question here. Can you explain how all of this data comes together?
So we typically bring data together by leveraging two basic files, your 837 file, and that can be both the 837I for your technical claims and 837Ps for the professional component. We bring in, typically nightly, a client's billing data through those 837 files, and as that billing data is imported or brought into our platform, our database, we calculate the expected reimbursement by matching or affiliating, if you will, the account payer code to the appropriate contract. And then we also bring in 835 data where we capture not only the denial code activity, but we can bring in the expected allowable provided by the payer, the contractual adjustment provided by the payer, the patient portion, and the payer one payment, again, provided by the payer. So we typically use those two files for the majority of the data that we need. We can also bring in things like a daily cash transaction log, so we can track other payment activities, adjustments, etc. But from those two basic files, we're able to really capture all the information needed for reimbursement variance analysis.
Great. Next question here. Is there a way to know how to prioritize efforts based on previous experience?
The biggest thing I would say with that is just to review the data. Utilize your trends, utilize your collector success, continue furthering education. That's the one thing that I utilize the most is being able to have this data at my fingertips and meet with an employee one-on-one and say, hey, your collections was X amount in January. I need them to be here in March. And just to be able to really sit down with them and pull up where they've been successful with different payers or with different denial codes, or they were able to get this claim overturned in 60 days versus with a different payer for 90 days. And I think just the data analytics there and the visualization tools to be able to sit down and kind of monitor, track, and trend is very helpful and can create a lot of success just going further with your employees.
Great, thank you. One more question here, and this is more product related, Greg, to what you were speaking with the AI ability. Is that something that's already currently available in our platform? And is that more of an add-on feature versus an automated upgrade in the platform?
Yeah, it's something that we are incorporating into the platform. We're currently using it more internally with our recovery team. So it's more of an internal in testing, if you will. It's something that hasn't been fully released to clients at this point, but it's through our typical processes, we want to learn it, teach it, and then build it. And so we're in that build phase, working through that testing component before actually releasing it out to clients. And you know, one of the advantages that I think we have as an organization is the fact that we do use on a daily basis our software applications, the data visualization tools, the analytics. As Jenna covered, you know, it's what we use on a day in, day out basis to help our clients identify and collect reimbursement variances on often a contingency basis with zero balance accounts. That same tool is what's used when we deploy the system for our clients to utilize in their underpayment analysis. So that's typically our development flow process, but yes, it is in place, underway, and currently being used, just not fully deployed out to clients today.
Yeah, that makes total sense. And then a follow-up question to that, if we know this yet, will this be available for the professional side or only technical?
We'll be looking at similar type variance analysis processes. Obviously, registration variances do create a lot of false variances. And so, you know, the ability to do dual calculations, if you will, calculating accounts against different contractual rates and terms, is something that we have been working with several different clients. It's something that there's high interest, both internally and externally within our organization and out with our clients. So we'll be looking to incorporate those types of things on both the technical and professional side.
Okay, great. And I do have another question, and this is more of a denial related question. So when we're talking about denial analysis, since the primary denial reason code is based on the line item with the highest charges, is it based on hard and soft denials or only hard denials?
Jenna, do you want to take that one?
So hard and soft denials, in short.
All right, great. Well, if we don't have any further questions from the audience, I think we'll wrap up here. Greg and Jenna, thank you very much for your time. And before we do sign off, I just wanted to share some additional resources that we have for you all. Some of you have probably been attending our recent monthly webinars. We do put together educational sessions every month, and you can see that we are on an analytics focused theme right now. So next month, we'll be talking about how to incorporate analytics for your next ChargeMaster review. And then in August, we'll be talking about analytics that you can incorporate when we're talking about patient collections, because obviously that's becoming a bigger source of revenue as things move more toward price transparency and patients are more responsible for their costs. So you'll see more information on those sessions coming up here in the next couple of weeks. And with that, I'll turn it over to Greg and Jenna for any final closing thoughts you might have.
Thanks, Brad. I
like
really
you
appreciate you all. Oh, sorry. Sorry, Greg. I just wanted to quickly say thank you to everyone for your time. I know how precious it is right now. And thank you, Brad, for allowing me to be a part of this today.
Thanks, Jenna. We do appreciate you sharing your time and insight with our clients and with other executives in the industry. Obviously, we're going through some tough times. Many organizations have furloughed employees. Most organizations are still working from home, similar to PMMC to a very large extent. But we have to find ways to keep moving forward. And, you know, I think as we look for ways to continue moving forward, we're going to have to look at data and information in a new direction. And that's really where analytics comes into play. We certainly want to continue to be a resource to the industry, to our clients. And we have found these webinars to be definitely something that has been well received by the folks that do attend. We certainly hope you will continue to provide us with feedback with what's important to you so that we're addressing questions that you're dealing with on a day in and day out basis. Our focus here at PMMC is to really calculate that expected reimbursement as accurately as possible, and then look for ways to leverage that data to help you become more efficient with what you do. So not just underpayments, but negotiating better contracts, managing your revenue cycle more efficiently, adjusting charges, handling that patient component as consumers really start shopping more and more frequently. We want to make sure that we're constantly out there being a reference and a value to you guys. So Brad, thanks again for coordinating today's session. And we do hope everyone continues to stay safe and continue to take care.
Thank you again, everyone.